All right, so for this next segment, we're going to talk about how to recognize the signs and what are the actual things that you're going to be looking for when it comes to heart related issues. So let's take a look at this and get a feel for what we actually are going to be looking for. So, signs and symptoms of a heart attack, pretty straightforward. Here you go. So you're going to see some chest discomfort, pain, pressure, or squeezing in the core of the upper chest. It's about 3 to 5 minutes or longer, and it doesn't go away. Sometimes they go and come, but it's really gets pretty consistent. You'll also see back, shoulder, and neck, jaw pain, and part of the upper stomach. Some other signs and symptoms: dizziness, trouble breathing, nausea. You're going to see a skin color that might look like it's almost losing blood. So instead of red, you get almost gray in color. Um, real nervousness, so anxiety. You see fatigue, and maybe you could talk to them and they might not respond. Um, Everybody responds to heart attacks differently, and you noticed in the first video that it was about how you look at um, women versus men. A lot of times for women, we're talking about just mild sick symptoms, nothing that's over the top pain, but sometimes just indigestion, almost feeling. And that's really important to understand. Um, Also, men, like I said, have classic symptoms. Women tend to show just different things: sickness, lightheadedness, those kind of things. So when do you call 911? First of all, anytime you have a heart-related emergency, 911 is automatic. It isn't a, I want to think about this moment. Secondly, be ready in a heart situation to give CPR or use an AED. And those are part of this lesson and our next lesson. How do you do those things? Okay. And then lastly, get the person comfortable. Let them rest. Let them be in a comfortable position. Try to loosen up their clothing in any way possible. Um, Also, understand if they have medication that they normally use. For chest pain, a lot of times older people will have heart medication. Be there with them and get it for them and help them take it. And then just reassure them that you're going to be there until the EMS people arrive. Um, then understand a few things. When we talk about what's going on with the heart, a few things that we kind of have to pay attention to are what's really going on. Okay, and how do we go through that process? So you can see this. I mean, the cardiac arrest happens suddenly without any signs or symptoms. Cardiac arrest is when the heart will absolutely stop beating or not beat well enough to circulate blood. Um, Signs and symptoms again, or causes. We have some sort of heart disease, some sort of trauma. Maybe you're in a car accident, those type of things. Any sort of choking emergencies can lead to heart attacks, shock, drug overdose, those kind of things all can stop the heart from beating. And understand too that a heart attack and a cardiac arrest are actually two different things. So you can have a heart attack and that can lead to your heart stopping beating. Cardiac arrest is when it's absolutely not beating. Okay. Heart attack is the blockage um, ahead of that that allows for the heart to start to get to the process of stopping completely. All right. We'll hang off on this one for a moment. And here we go.